85% of babies will be born between now at the 38th week and 42 weeks of pregnancy. So little to go, at most 4 weeks. Your baby is in your lap, and I know that anxiety is like that. You're entering a phase we call Pródomos, and I'm going to talk about what's going on with your baby. There is also a video. I will tell you about what the real indication for a cesarean section is. Talk a little about this, discomforts. Do you have eating tips and tips for the week? There's more than one tip because there's a lot for me to tell you. So, you know what? Stay with me. I'll tell you. Hello, I'm Monica Romero. I'm very happy to have you here with me, even happier because you are in the final stretch. Soon you will have a baby. And calm down. If you are afraid of childbirth, how will this giant baby come out of me? Calm that most births are well reported. Most births happen. It's okay. It's just that we get hung up on bad news. But first I want to talk about you and this big belly and this. Realizing that there's almost no room left. If we measure her uterine height, today it will be around 38 centimeters. Is a respectful belly, but it weighs, and as it weighs, we have more back pain, we have more constipation, we have more heartburn, we have more sciatic pain. And to alleviate all this, why do we do everything in one fell swoop? There's no solution, no. But a hot bath with water hitting your back or sciatic tends to ease that exercise from being rolling on the Pilates ball as well. It also helps to relieve not much during exercise. It can still be a little uncomfortable, but after a while. It also relieves a little. And the heartburn part, the bad digestion, is because of the stomach. You're too stuck. But now, at 38 weeks, that's when the baby starts to descend a little further into your pelvis, which can give pain and numbness in the hip, but it will relieve your lung and it will also relieve your stomach, allowing you to eat a little better, have less heartburn, right? And reflux, and also that you can give that expanded one in the lung, you know, that relieved breath. But at the end of pregnancy, it's a difficult period. Baby came down. What did he do? By my bladder, there are trips to the bathroom. This really can't get much better. You may have also noticed that your breasts are heavier. And at the time of a hot bath, the time that hits the hot water leaks a little bit of colostrum. Or you may notice a little bit of colostrum in your bra. If by chance that little bit is a little bit, maybe it's better to use a breast pad so you don't stain all the clothes because the colostrum stains the table. One thing I'm going to ask you is not even there in my tip of the week. I'm going to ask you now is that from now on you avoid closed places, such as shopping centers, for example, and parties that have many people, because for you to protect yourself and avoid contact with flu viruses. Cold, because they can hinder you in labor or in your recovery. Coughing when you have a C-section scar is not for anyone, no. So try to avoid those places you prefer, right? Airy places, contact with few people. If possible, even use a mask to be able to preserve yourself. That now is your time to focus on you, on your labor, on concentrating for that moment. And if possible, whenever possible, that rest is going to be very important for you now, because you won't have much time to rest after the little baby arrives, see? And it's going to be like that for years and years, because that's the mentality, right? We end up dedicating many years to them until they leave, demanding less and less, and we regain our time. But when they are little, they need us a lot, and it's a delight because they recognize all this work and they have such a conditional love for us mothers, which is magical. He's wonderful. Let me talk a little bit to you. I talked a little bit last week about the stages of labor, and I commented that you now enter Prodomos, so now it's okay. It's not exactly on that date. And some women go through this Pródomos without understanding, without realizing, without themselves. Symptom would be more or less an increase in contractions. Bracts that are so rich that they are painless, they will become a little more colicky, but they are not retinized yet. It happens 1 hour because other are short. So this would be the produce that would be a pre-labor. I'll leave an image about him here, remembering that you can find all these images on my Instagram, okay? No need to print the screens here. Everything is there to help you, for you to save and consult whenever you want. But there are a lot of doubts about cesarean section. There are many people who dream of a normal birth, fear of a normal birth, dream of a cesarean section, fear of a cesarean section, and often this happens due to lack of information. What I need to tell you is that your dream is to have a normal birth. Some things can make them impossible, and it's about them that I'm going to talk now about cesarean sections, real indications of cesarean sections that I'm going to talk to you about. Of course, some you can talk to your doctor. For example, the baby is sitting. Some doctors do not perform tonal delivery with sitting baby, and there are others who can do an assisted delivery in this situation, but then it will depend on the doctor. Okay, now what is indication of cesarean section, which is indisputable? A prolapse cord. What is this? This is when the umbilical cord comes out before the baby. When this happens, you have to perform a cesarean section. The transverse baby, right? Transversely, when the baby is in this position, unfortunately, it is also an indication for cesarean section. Also indication of cesarean section when the baby has some heart disease or hydrocephalus or a condition in which his organs are out of the belly. In these cases, cesarean section is indicated because, for example, in a normal birth, in the case of hydrocephalus, it can damage the baby's brain, for example, the baby's head. And when organs are exposed to pressure also during contraction, it can damage those organs. Then you can't either. Some situations of congenital diseases, right, of genetic diseases are also indicative and bad. Information is also not all, but some are also indications of cesarean section. But I won't be able to list them all for you, otherwise the video will be huge, and the same goes for mom, okay? Some mothers who have some heart problems or some health problems or very high blood pressure, they also need to undergo cesarean section, so talk to your doctor. They are also indications for placenta previous cesarean section. Rupture of the uterus, which is a rupture of the uterine muscles. This is also an indication of cesarean rupture of the vasectomy, prior eclampsia or preeclampsia in some cases. HELP syndrome, which is a complication of preeclampsia, is also indication for cesarean section when the mother has some types, not all, but some types of sexually transmitted diseases. Even herpes with active lesion is also an indication for cesarean section. Some other diseases are not, but herpes, certainly in some. In cases of multiple pregnancies, when there are two babies, the two are upside down, cool, we can have a normal birth. When one of the two is not upside down, it may be an indication for a cesarean section. And when they are triplets, 4 quintuplets for both the safety of the babies and the mother as well. Cesarean section in another case is when you have fetal suffering, which includes some babies whose little heart is already starting to beat irregularly, okay? So all these are indications. Real struggles for cesarean sections. Can the other indications happen? Yes. Emergencies may have some factors that I didn't comment on in this video, okay? So it is important that you talk to your doctor, that you understand what is happening, and the birth plan helps you a lot in this. If you haven't already, here's OP PDF for you to download. And now that I've talked about all these cesarean indications, I know you're super excited for your delivery so that it's born soon. You know, Monica, what do I do to speed up the delivery? One of the most effective things to speed up labor is long, slow walking and sexual intercourse. A man's semen contains a substance called prostaglandin. Oh, what a difficult name. What about this substance? When a woman is about to go into labor, she becomes receptive to this substance. And this substance has been proven to accelerate childbirth. So that's 11. Good tip, some women also report that they improve when they do exercises on this big Pilates ball, when they stand or jump on the ball or do this circular motion. Spicy foods are also things that can help you. Of course, these are tips to accelerate naturally, okay? Artificially, there are some hormones, but this you have to discuss directly with your doctor. And since we're here in this childbirth mood, let's talk about your baby. Your baby is so big that he can no longer move much. He moves very little. However, if you notice that he has been for more than 3 hours without moving, poke his belly, eat something sweet, a treat stays. This is indisputable. We have to pay a lot of attention at this moment. And your baby is so big that he's already measuring about 48 centimeters from head to toe, which would be about 35 centimeters from head to butt and weighing about 10 pounds. Please note that these are approximate measurements and weights only. The genitals of the boy or girl are already fully formed, and the earlobe, this cartilage, is also already formed, which makes the ear a little firmer. This week, although the development is a little less accelerated, his digestive organ is super functioning. Just as his lung continues to mature, the surfactant liquid in quality and quantity better, and about his digestive system, he continues to swallow the amniotic fluid that has cells, the lanogos, which are those little hairs that are loosening a little bit of the casus vermex. He is swallowing this amniotic fluid, and all the solid part is being accumulated in his intestine. Meconium is being formed, which is the baby's first poop, and that breastfeeding colostrum helps a lot to balance the intestinal flora and release this meconium is still not common. Is this meconium in the amniotic fluid? I know there are a lot of people who are afraid of this. Calm down, who don't have to worry about it yet. It's totally uncommon for this to happen around 38 weeks, which can happen during normal delivery because of the force the baby ended up defecating, but that's during delivery, and that doesn't mean fecal distress. And for you who are curious about meconium, it doesn't. It doesn't look like a common stool. It's a different stool. It looks a little more greasy. It's viscous. It's even a little more difficult to clean the baby. It doesn't have much smell like normal stool. It has a softer smell, and it has this aspect here on the side. You see half black, half green moss, and it is formed, as I told you of lanogos, of the amniotic fluid, of the substances that go there into the amniotic fluid, of digestive substances, of substances that also come from the pancreas. So it has all the substances, not only from the baby's digestive system, but from everything, right? Of cells, everything that he released during this period of gestation and that he swallowed there of the amniotic fluid. And my food tip is delicious. Popcorn. Oh, let's have popcorn. You know why popcorn helps, right? In peristaltic movement, help in digestive functioning. It's delicious. It doesn't cause digestion either, so enjoy it. Take care of the popcorn, but it's not meant to be microwave, okay? It has to be the pot, but we're not going to generate a little salt in the salt at this point in the championship and amending the popcorn tip. My tip of the week is that it's at Cineminha with popcorn. Why don't you invite a friend or partner, mother, someone you like to enjoy a movie? Look how delicious. Film with popcorn now at this point in the championship. Stay there without sitting. Get a comfortable chair. If possible, cover some popcorn, watch a little movie. It'll be a super yummy moment for you. And if you happen to be there with a partner, already a romantic dinner, it will take a while for it to happen. See, it doesn't have to be in a restaurant, it can be at home. And take advantage of this dinner to talk. What will your life be like in 10 years? Or 18? I'm going to tell you that I made a big mistake, okay? But it's a very nice conversation. I had this conversation with Flavio. It was sensational. So I'm going to nominate you too, because for me it was special, for you too. I will very much hope that it is. And my second tip, take advantage. Although it is not easy to take this belly back and forth and go to the supermarket, already gives a lunch on healthy foods, which are easy to prepare for your day-to-day. For when you come back from maternity, you already have enough stuff stocked. But you take a lot of perishable things, right? Because since we still don't know if the conversation will happen today, tomorrow, in a week, 2 weeks, taking a lot of perishable things can end up spoiling it, right? Especially for the days you may have to stay in the hospital. So don't take much perishable stuff, but already supplies the pantry there. And when you have to do, buy, enjoy, and see if you need a thermos that has not been used for tea, coffee, juice, anything like that. It is to leave the water hot when cleaning the baby's butt, because it is not advisable to use the wipe in the first days of life, not even in the first few months of life. We use the tissue when we leave the house, when we go to the pediatrician, when we go for a walk. But at home, it's a little cotton, right? Those cottons can be the ball, the square, which you think is best, those cotton rolls, which was what I used too. And then we will soak it in warm water so we can clean the baby. Unless you already have the exchanger in the bathroom, which has a hot sink, you won't need it. But if you were like me, who left the changer already in the children's room, the thermos helps a lot. So check if you have a bottle at home or if you need to buy one. Enjoy it, leave everything organized, which even gives a feeling of relief. Take advantage of these last days to rest, enjoy, talk with the people you like. I'll give myself freedom. We didn't even give me that freedom. I keep asking you, how are you? How was your birth? If you arrive by next week, start the video by saying hi to me, saying, Monica, I arrived at 39, If you don't get to 39 and just stay here at 38, I'll see you in the baby's development or in the videos I talk about labor. Thank you from the bottom of my heart for letting me participate in this very special moment. Don't forget to let me enjoy it for myself. I'll see you in the next video or in the 39 weeks baby development in any video I find you.